Hi John, it's Dr. Stetson inside this right knee of yours. Give me a little tour and see what we can do to hopefully help you. First you see this metal probe. I know that metal probe looks awfully big. It's actually very small. It's only 3 millimeters in size. Next you see this blue tube or cannula. That hole there is also 3 millimeters in size. We're constantly irrigating your knee out with fluid, getting rid of anything that may be loose or floating around. And as you can see, little white particles, that's a little bit of loose cartilage that you see kind of getting sucked out. Now we're looking at the bone surface down below. This is called the plateau. Medial tibial plateau. A little bit of arthritis developing. See that little softness, but not so bad. Now as we rotate the arthroscope up, we can see here you've got a little bit of more softening right there. Do you see that? So I'll be smoothing that area off. A little bit of early arthritis developing. As we come here, there's more. Look at this. See this? This was what I was worried about. There's more arthritis right there. You see that big loose flap of cartilage? I'm going to take my shaver in a second and smooth off that rough area right there. But again, this is normal cartilage. As we get over here, we have that roughness. Let me get my shaver in there. Hold that. And our shaver, the purpose of that is to start smoothing out some of these rough surfaces so that you get rid of this loose cartilage that can cause pain and swelling and catching and locking. As we come here, again, look at that big flap. You see that big flap? So we want to smooth all this off for you. There's a bigger piece right here. Do you see that? Look at that kind of, you'll see that in a minute. Again, this is all on the inside part of the knee where most of your symptoms are. Again, we haven't looked at the meniscus yet, but we're going to, again, get rid of all this loose cartilage. There's a big flap right in front of us that I'm shaving away right now. John, there's a big loose cartilage on the inside part. And then you can see this thing right in front of us and get between it, right here and here. You see that? All that is loose cartilage. So coming from the bone down below. So when you can see it sort of sheared it off, if you will. See this flap right here? I'll take my shaver and clean off and probably chop it away in a minute. I show you this big loose piece of cartilage. See that? How it's peeled away from the bone right there? Ouch. So I need to smooth that out of the way. This used to be attached right here. You can see it's not anymore. So again, the other side of it, you need to kind of clean it up. I'm taking my little scissors and watch this. You're going to chop it away. So now I'm going to remove that piece right there. My blue tube, I'll grab it. You get a big loose piece of cartilage here. So there's the piece right like that. You can see the extent of it, so I'm going to take that out. We've got more to do. So you can reach in here and grab a little bit more. Look at all of that damage right in here. Again, a lot of loose cartilage here, so look at that big loose piece there. Let's see what we got. So, again, all that area right in there. So I'm going to smooth that off for you with my shaver. All these loose fragments. We've got this area of raw bones. I'm going to take a little burr and just scrape it. It's a pretty small area, actually, smaller than I thought. About a centimeter by less than a centimeter. But again, this is where some of the cartilage came from, so I scrape it, hope to give you some protection or a cap in this region. I showed you this area that we scraped. Now we're going to turn the water off. You're going to see it bleed in a second. So by bleeding, it brings in some new cartilage there, and it'll basically cap that region. Now this area is not down to the bare bone, which is good, so I'm going to leave that. But again, just that area. So we're going to look at the meniscus in just a second. So here's the meniscus, and look at that. As I pull it out, you're going to see this flap right there. So that can get caught right there. So I'm going to trim that area out with our little arthroscopic shavers, you see those come through in a minute. This is it's called the medial meniscus, which is way in the back part of the knee. So as we come through our blue tube, take this and we'll suck all that area out. All the way, we're constantly sucking the knee out with fluid. Go way in the back and try to get rid of all this loose meniscus or cartilage. Way back in here. There's that tear right there, coming underneath it. Come right through there. We'll suck all these pieces out in a minute. So to try and give you some idea, we're way in the back part of the knee. I'm trimming out that meniscus and just, again, big tear way back here. As we come over here, see how where that big flap was? Now we smooth a fair amount off, but everything's going so far so good. That arthritis area is right up above, and so, again, a little softening there. This is the area about where we scraped also. So John, we finished on the inside part of the knee. We're in the middle called the notch. This is the ACL, anterior cruciate ligament. Nice and healthy. See those fibers right here. Posterior cruciate ligament is behind it. That's that structure right there, and that looks fine right there. Let's go to the outside part of the knee and check that out in just a second. So we're on the outside part of the knee, and this is what's called the lateral meniscus, and that looks fine. That structure right there. The joint surface is down below. Look fine, and up above. All that surface here. Make sure there's nothing way in the back. Straighten out the leg for you just a little bit. There we go. There we go, just like that. Hold it. And again, all that meniscus way in the back looks fine. All the structure here. Now we're going to slowly straighten the leg out and look up above. As we look up above, we want to make sure we don't have any arthritis on the outside part of the knee. And that looks very healthy. Look how nice smooth surface that is. That's called the lateral femoral condyle. As we make it all the way straight, that looks perfect. So no arthritis on the outside part of the knee. Let's go up by the kneecap and check that out in just a second. So we're up by your kneecap. You can see a little bit of arthritis up above. Do you see that little stuff hanging down? So not too bad, but I'll smooth that off in a minute. There's our blue tube. This is the groove that the kneecap slides in. That looks fine. See how nice and smooth that is? Nice smooth, what we see, articular surface. Again, there's our kneecap. A little bit of arthritis there as we go on the outside. You can see a little bit of inflammation. We want to make sure there's no loose cartilage way back here in the back part of the knee. And this looks fine. See that? No, that's the lateral meniscus. Up above is the lateral femoral condyle. Meniscus is there, and the plateau is actually down below it. And again, no loose cartilage out on the outside part of the knee, which is good. When we go up by your kneecap area again, there's our blue tube. As we back up, you'll see that kneecap. There it is. And this is the inside part of it. You have a little bit of a plica. You see that shelf of tissue right there? I'm going to get my shaver in there and clean that out for you in just a second. Here, hold that. Show you how that works. Again, this can sometimes irritate people. So this little shelf of tissue. Clean that out for you also. So again, this is called a plica. This is a big fold of tissue that is pretty big in your case. So it's folding across underneath the kneecap. So this can cause some of your symptoms also. So shaving that away, you won't miss this one. But again, all this area right here, the kneecap again is up above. Let's get all this area, and we're going to address that kneecap in just a second. Again, smoothing out the inner surface of that kneecap. A little bit of loose cartilage there, but not too much to worry about. Not down to the bare bone, which is real good news. So last thing we're going to do, John, is we're going to irrigate your knee out with lots of fluid. Again, you had a big tear of the meniscus on the inside part of the knee, and also a piece of loose cartilage that was catching back and forth. So we smoothed that off, and there was a small little area on the inside part where it actually was down to the bare bone that we had to scrape. Outside part of the knee looked fine. Then the kneecap, a little bit of arthritis around the kneecap, and then that area called the plica, which is that big fold of tissue. So everything's gone just fine. I think you'll make a real good recovery from this. I think it'll get you back to all the activities that you like to do. So we'll call out to your wife and let her know that we're finishing up in just a few minutes. We're going to irrigate your knee out with lots of fluid. We'll see the recovery room in just a minute.